Hi, my name is Matt Bowers, and I am presenting today on my own case study entitled The Analysis of the Provider Shortage in Occupational and Environmental Medicine. Occupational and environmental medicine is defined as the medical specialty devoted to the prevention and management of occupational and environmental injury, illness, and disability, and the promotion of health and productivity of workers, their families, and communities. As we explore this case study, you'll see that one of the main issues related to the shortage of occupational and environmental medicine providers deals directly with communication, specifically the lack of communication to medical students and medical schools. Now, occupational medicine got its start in 17th century BC Egypt. There's a scroll that was identified and discovered that records many different injuries of construction workers and soldiers of the day, and this is seen as the first record of work-related injury and treatment. But in approximately 1700, with the book De Mortis Artificum Diatriba, Bernardo Ramazzini became known as the father of occupational medicine. And it's from about this time that occupational medicine was considered its own medical specialty. In his book, he identifies jobs that were common of the day and common illnesses, injuries, conditions that affected the people who performed those jobs, and then advised treatment for those illnesses and diseases. Today, occupational medicine providers perform a variety of duties, but there's three main, what I would say, buckets that they operate in. One, they provide care for acute work-related injuries. So this is where someone is injured at work, be it like a laceration, a burn, a broken arm, something like that, and they're sent to an occupational medicine provider for treatment. Second, if those patients then need referrals elsewhere to maybe a specialist or a higher level of care, these providers would manage that ongoing treatment of those patients. And lastly, there is a significant amount of effort made on an occupational medicine provider's part to work with the employer to prevent future work-related injuries. They're going to oftentimes visit employers, visit sites and factories and things like that, anywhere where workers are, to identify things that can be put in place to prevent injuries. They're also engaged in preventative medicine through physical exams, through drug screens and things like that. In the height of the specialty, what you would say its heyday, of the 1980s and 90s, there was approximately 3,500 board certified occupational medicine providers practicing in the United States. Today, that number is down to about 1,400. The workforce in the United States, according to the Bureau of Labor Statistics, sits at about 170 million individuals, and there's approximately 2.5 million work-related injuries reported annually. So you really don't want to see a decrease in the number of providers who specialize in treating work-related injuries when the number of workers and the number of injuries are increasing. So what are the causes? Well, there's two main causes, and they really go hand in hand. The first cause of the shortage has to do with funding for residency programs. You see, in the United States, residency programs are primarily funded through the Center for Medicare and Medicaid Services. Because occupational medicine deals with a population of patients who are working age, who are otherwise healthy apart from an injury, and don't qualify for Medicare and Medicaid, Medicare and Medicaid in turn does not fund these programs. Because of that lack of funding, then these programs don't have the monies to go out and market and recruit medical students. So you can see how those two reasons, the lack of funding for the program and the lack of marketing to med students, go hand in hand. If we're going to increase the number of occupational medicine providers, and if we're going to solve this problem of the shortage, then we have to change the way that residency programs are funded. This is going to require legislation to be enacted. This is going to require efforts made to change the way that monies are funneled to residencies, and they should not solely be based on funding from the Center for Medicare and Medicaid Services. There's going to have to be an increase in marketing to medical schools. This doesn't necessarily require legislation, but it does require significant effort to be made on the part of maybe healthcare organizations and universities to provide funding or to fundraise in order to increase awareness for this specialty. Studies show that only 20% of medical students in their first year of residency have ever even heard of occupational medicine. Those two solutions are going to take some time. So most immediately, to solve the gaps in the care of these patients, enlisting advanced practice providers such as physician's assistants and nurse practitioners is going to be crucial. They have broad training and can often just be plugged into a variety of specialties and are well equipped to handle the treatment of these patients. Now, in reviewing the case study, though it's the one that I submitted, I can already identify some strengths and weaknesses in the arguments made. I think a key strength is the explanation of the importance of occupational environmental medicine. I think the importance of it is clear for the public health of the American worker and the American workforce. However, I do think more data could have been presented on shortages in other specialties to better illustrate that specialties such as primary care are not equipped to absorb these patients as occupational medicine departments remain understaffed. Primary care is facing its own access issues and its own shortage of providers. So more data could have been offered to show that solutions have to be made that relate to occupational medicine and not relying on primary care and other specialties to take over the care of these patients. I also think more explanation of the steps to get legislation passed could have been explored, and also to get APP providers, advanced practice providers, trained to absorb these patients affected by the shortage. As occupational medicine does present its own nuances, such as all the work that goes into filing claims with work-related injury insurance and all the paperwork associated with that. I have 3 questions for you as we come to a close today. First question is, in what ways do you see the shortage of occupational and environmental medicine providers affecting the public health of the United States? Second, how could university programs better recruit medical students to occupational residencies given the inadequate level of funding available? And lastly, what alternative solutions to this shortage do you identify? Just as primary care providers are essential in the treatment of acute illnesses and the prevention of further progression of chronic diseases, occupational medicine providers are equally crucial for the management and prevention of workplace injuries and the overall workplace health and safety. Shortages in this field have the potential to affect the wellness of America's workforce for years to come, and for this reason, a solution to this shortage has to be made and found now.